both of them are very similar. So your brain can't always tell the difference what organ it's coming from. It just knows the location.
They're neighbors. Won't you be my neighbor?
Won't you
Along with
be my
Mr. Rogers.
never?
Yeah.
The information shared on this podcast is for general educational purposes only and reflects the host's personal views and experiences. It does not constitute medical, legal, or financial advice, and no professional relationship is formed by listening to this podcast. As always, consult your own qualified advisors regarding your specific needs and practice. Thank you.
Welcome to But Seriously. Today, Dr. Soyka and I are going to talk about the ins and out of GERD. I have no clue what GERD is and what GERD stands for, Dr. Soyka. So enlighten me.
Okay, so even though you don't know what GERD is, you probably had at least some symptoms of GERD at some point in your life. And so let's get into it. So one of the most common complaints a gastroenterologist will see is GERD. And I'm only going to refer to it like that from now on because it's more
Same.
fun. Yeah. It's definitely more fun to call it GERD.
GERD.
All right, so GERD stands for gastroesophageal reflux disease. And so basically what that means is gastric contents, which tend to be acidic, are refluxing or coming up into the esophagus. Right,
What that? Okay.
like that. And so GERD is GERD, the disease, has many different symptoms. And so people think that if they don't have heartburn, which is the classic symptom of GERD, that they don't have GERD. But that's not true. You can have a lot of different symptoms or none and still have GERD. So some of the classic symptoms of GERD include heartburn, obviously, something we call non-cardiac chest pain. So sometimes we'll get a consult in the emergency room for somebody who thought they were having a heart attack because their chest was hurting so bad, but all the cardiac workup is negative, and it turns out it's from GERD. Um, Also, what we call epigastric pain. So pain right below your breastbone here, right in the sternum, especially after you eat. That can be a symptom of GERD. Excessive throat clearing all the time, GERD. So is especially morning cough, GERD. Difficulty swallowing can be a symptom of GERD. So when you're eating, food is getting stuck. Regurgitating of contents, so things coming up. Acid
Like you
breath
think you're gonna vomit?
could be
Like,
GERD. Um, Acid brash in the mouth, sort of
ooh.
tasting like acidic contents, that can be GERD. So there's lots of GERD-y symptoms.
Okay. I wrote all 8 of those down. So let's back
You
up.
were writing furiously.
I know. I'm a nerd. Okay. I was such a brown little nerd in school, and I continue to be. I drive my doctors nuts. So what is heartburn? Like, everybody uses that phrase left and right, but what the heck is really going on? Like, give me an example. I ate something, and what's my heart doing?
Your heart is totally fine. It's just this sensation of burning in the chest.
Oh,
Near
here.
and because your heart is here, it got termed heartburn.
But there's nothing going on with my heart.
Nothing is going on with your heart. It's beating just fine, girlfriend.
So it's just this area. Okay. And like, I could have eaten too much tomatoes or something, and it feels like I'm on fire. Like, this girl is on
Exactly.
fire.
Girl is on fire. So, there are a lot of foods that increase acid secretion. So, some of the more common foods are tomato sauce, like you said, tomatoes in general, but tomato sauce because it's so concentrated, right? Spicy foods. So,
I'm
hello,
screwed as an Indian.
brown
Yeah.
people, right?
Yeah.
Coffee. And
Oh.
interestingly, people ask me, like, oh, is decaf coffee okay? And I'm like, no, it's actually the bean. because this similarity is also with chocolate. So that's why the crossover between coffee and chocolate is because of that cacao bean. Caffeine also can increase acid secretion, but it's really that bean. And then citrus, so things like lemons, limes, oranges, and grapefruits.
Mm, okay.
Those are probably the biggest triggers. Some people are also sensitive to garlic and onions and fat, but those, in my mind, are kind of like second tier triggers.
Garlic, onions, and fat. So the top offenders are tomato sauce, spicy food, coffee, chocolate. That kind of breaks my heart, and some citrus, and sometimes garlic or onions. So basically, if you're Indian, you're screwed. So we talked about heartburn. Now, non-cardiac chest pain. Yes. Okay. My friend Patel works in the ER, and she says one of the busiest day for plumbers in the ER is like the day after Thanksgiving. Plumbers, because everybody's like, like at home
You mean
screwing up the
plumbers, like
toilet.
human plumbers, like me?
Yeah.
Yeah.
Plumbers are really busy, and then the ER is slammed because people are thinking they're having a heart attack, but they actually overate. So what is my body doing where I'm thinking I'm having a heart attack, but I just ate too much?
So what happens is the biggest trigger for acid secretion in your stomach is food. So you eat and your stomach secretes all these different things to help digest the food. It's not only acid, and it's literally hydrochloric acid, but it's not only acid that's secreted. There's lots of other digestive enzymes that are secreted from both stomach cells and pancreas cells and all these other cells, bile. So all of these enzymes are secreted to help digest the food, but food is the trigger for the secretion of this. And so you eat, and the more you eat, the more is secreted into the stomach. And then
Mm,
food doesn't just pass down, into your small intestines immediately,
mm,
right? So you're sitting there with a bunch of food in your stomach. And if you shove a bunch down to your gullet real fast, then all of a sudden more and more acid is being secreted. And then, you have this huge belly full of food and a bunch of liquid acid. And some of that physiologically comes up into your esophagus. And when that acid liquid touches the mucosa or the lining of your esophagus, it legitimately burns it. It is like pouring acid on your skin. I tell people it's like, have you ever had an acid burn on your skin? That is exactly what's happening internally. And that can become a big problem. Like the more acid you expose your esophagus to with time, that increases the
mm.
risk of lots of things. So you can we actually grade it. It's called esophagitis when we go in and do an endoscopy. Which,
Yeah.
and there's grades A through D. And I like to tell people we're grading to see how bad the burn is. So it's kind of like grade A is like a rug burn, like a little bit of
Mm,
redness. Grade B is
yeah.
like you fell off your bike, but you weren't going that fast. But
Right.
grade D is like weeping, bloody, like you fell off a motorcycle and you weren't wearing pads. You can really erode the esophagus that bad and you get bleeding, you get scarring, you get all sorts of problems.
So that burning mimics, like, I think I'm having a heart attack or here in the chest area.
Yeah, because it's right
Um,
there, right? Your heart and your esophagus are in the exact same place in your chest. So the nerves that innervate both of them are very similar. So your brain can't always tell the difference what organ it's coming from. It just knows the location.
they're neighbors. Won't you be my neighbor?
Won't you
Long live
be my
Mr. Rogers.
never?
Yeah. And the epigastric breastbone, that's kinda like the same thing, like right here under my
Exactly.
bra line or above?
Yeah, it's like hold on, I'm gonna put this microphone. It's like here,
Yeah, under my bra
right
line.
where
Okay.
the sternum
Yeah,
ends.
yeah. And we all know what tell me what's going on with the excessive throat clearing if we
So
have that
yeah,
all the
so
time.
usually that's because acid tickles all the way up to the vocal cords.
Tickle, tickle.
Tickle, tickle.
Mhm.
And when acid touches the vocal cords, they hate it. And they start forming like this mucus on the vocal cord and
Mm.
you can't get it off. So people are like trying to clear. Sorry if that sounded really
Acid
bad,
again.
but it's all
Acid
acid
again.
mediated. And so that,
Okay.
has we can talk a little bit about, diet and lifestyle stuff later, but I tell people when you're trying to manage GERD, you need to keep gravity on your side. Meaning, if you eat, you want to eat and then let all that food pass, right? We just talked about like how long it can take for the stomach to empty, which is up to 4 hours in a normal person. Um,
Mm.
and you want to give the food time to get into the intestines so that acid stops secreting before you lay down. If you eat at 10 o'clock and go right to bed, you have a belly full of food and acid, and then you go parallel, right? There's nothing controlling the stomach going, all those juices flowing right into the esophagus. So you've got to angle yourself up at the very least. Like sometimes we'll tell people use a wedge pillow to kind of keep yourself elevated. I like to use the analogy, keep gravity on your side, keep things being pulled down rather than
Down. So
in a
stand,
line.
be upright, walk, move, things
Correct.
like that.
Exactly.
Okay. Morning cough. What's going on there?
Same thing.
Same thing?
Hmm.
Okay. Difficulty swallowing. What's going on there?
So that can be a couple things. So that can be, like I was saying, imagine if you have such bad esophagitis or ulceration, inflammation in the esophagus, you get a lot of swelling around all of that inflammation. And the swelling itself can make it feel like it's difficult for food to go down
Go
because it
down.
narrows the passage. But over time, the body is really good at healing itself, right? So let's say you do get a road rash or a burn. What happens? What does your body do to heal that on your skin?
It scabs.
Yeah, it forms a scab, and then that scab forms a scar, right? And so that's what happens in your esophagus too. And the problem is if you develop scar in your esophagus, that's not great because the esophagus is a muscle that needs to be open and moving at all times. And so if you have a static band of scar tissue, that's a problem because food can get stuck there. And so sometimes the body healing itself is a good thing, but also can lead to problems. So sometimes we actually have to go in and inflate balloons or use these wires to help stretch out these scar tissue fibers so that you can swallow better and things don't get stuck.
And things like I've gotten that feeling sometimes when I've eaten too much and I want to vomit, but I'm not going to vomit. So what's going on there?
Oh, I don't know. Maybe you just ate too much.
You said things come up and
Sonia,
acid,
this is not like a free consultation here for your
uh,
life.
I'm we're friends. We roll like that. I'm now wondering. Okay, so what is rash, bash, acid rash, bash in the
Acid
mouth? What
rash
did
is
you
like when you taste that acid all the way up in
Mm.
your mouth because it's come all the way up.
Oh, so it's traveled from my stomach all the way up here and it wants to get out.
Well, I mean, I don't know what it wants to do. I don't think it has a mind, but I think it's burning. I think
Freedom. Yeah, it doesn't taste good, but you do feel quite sick. So one of the remedies is do not defy gravity. Do not pull a wicked here and be upright. And how long do you want us like, okay, let's go into what are some of the things we can do so we don't get any of those symptoms that we talked about so far.
Well, so we talked a little bit about diet. So, the biggest thing is diet modification in acid reflux. So, if you want to manage at least mild symptoms of acid reflux, the first is diet and lifestyle modification. So, you've got to limit the foods and beverages that increase acid secretion. You have to limit them. The second is lifestyle modification. So I tell people, the stomach can take up to 4 hours to empty. So don't test that. Make sure you're at least waiting 3 to 4 hours after you eat before you lay flat. And if you know you have GERD, get an extra pillow or a wedge pillow. You want to angle yourself, keep gravity pulling down your stomach. Um, and so those are like the mainstays of diet, what we call diet and lifestyle modification.
Mhm. And, the main like, just educate us who aren't in medicine. The main point, like, where does the esophagus start? And its main main job is to get food down for you, right? From your mouth to the tongue?
So your mouth, this is your oropharynx right here.
Yeah.
And then when you swallow past the vocal cords, so the vocal cords split here. And underneath the vocal cords, forward goes down larynx and trachea. Behind is esophagus. And so the esophagus is about 40 centimeters long. And so starting from the oropharynx, and it goes all the way down.
40 centimeters.
Yeah, starting from
How
here.
long is that? That's like how, like, I don't know, how's 40 centimeters?
It's like this long.
From the chin to the
Yeah, like 2 feet.
2 feet. Okay.
And then the esophagus is a tube, basically. There, your food travels down. And then right here, under the breastbone, what we were talking about earlier is called the GE junction or the gastroesophageal junction. And that's where the stomach and the esophagus come together. And then the stomach is this, big sac, basically. And then that empties into it goes through a hole called the pylorus. And then that goes into what's called well, this is a big debate in medicine. Is it called the duodenum or the duodenum? And,
Yeah.
we'll forever not know the answer to that.
Okay. So we got 2 feet of tubes trying to get into the stomach to make sure we feel nourished and fed or hungry or like satiated when we're hungry.
Well,
Um,
the esophagus tube, the 2 feet long tube, it doesn't do anything with hunger. It just like it's like it's just a
yeah.
shuttle, just shuttles things down into the stomach. It doesn't function in absorption at all. It's just a muscle to move food into the stomach.
What happens like if I have chai that's too hot and like everything kind of burns here? Like I've swallowed it. Am I burning my esophagus or what did I just do?
Yeah, you are.
Mm,
Ease
I
up,
like it
ease
hot.
up on the hot chai. Your
Yeah, it's
poor
good shit too.
esophagus.
Yeah, I know, but it's the same thing with spicy food, right? Like, what are you gonna do? Like,
You know what's
yeah, it's
interesting? I was actually talking to one of my patients earlier today who is an Indian male, who's is a brilliant researcher. And we were just talking about GERD because he has
hard.
GERD. And he was telling me, because we were talking about spicy food and yada, yada, yada. And he was telling me how in India, they actually eat spicy food because, like, centuries ago, it was so hot there. And in order for the body to keep cool, one of the natural ways the body keeps cool is to sweat. Yeah. And so and same in like Morocco and all of these places where like desert places. So they eat a lot of spicy food and drink a lot of hot tea to make themselves sweat so that they can cool off.
That I never knew that. We do usually, particularly my in-laws, they're from, Hyderabad, so at the end of every meal, they have rice and yogurt. Like, the yogurt's supposed to calm and cool and they're always skinny. My people, Punjabis, we just look at food and we expand. Like, we see food and we expand, but Telugus are, like, naturally slender, but my people are not. But yeah, yogurt helps with the like, a lot of yogurt helps. It helps with the burn for GERD. So the other things with how do you get diagnosed with GERD? Like, how does it work?
So mostly it's symptoms, right? So just went over the symptoms of GERD or acid reflux. And so mostly it's symptom diagnosis. Now, that being said, if you have longstanding GERD, you've had these symptoms many times a week for 10 years, that's something that needs to be seen by a gastroenterologist because over time, we just talked about how over time you can get inflammation and you can get damage to the lining of the esophagus, and it increases your risk of something called Barrett's esophagus. And Barrett's is essentially precancerous cells in the lining of the esophagus from chronic reflux exposure. And I tell people it's really not that complicated how it happens. You know, what happens is all of this acid is washing away in the lining of the esophagus. And with all the contents that comes up, food, acid, juice, all that stuff, so are some stomach cells. And
Oh,
and
what?
yep, and Barrett's is just replacement of the lining of the esophagus. So it's esophageal squamous mucosa is being replaced by
Squamous.
squamous is being replaced by gastric mucosa, columnar cells. And the body is like, wait, what is happening here? Why are these cells in this wrong place? And so it kind of tags them. And so the Barrett's is actually synonymous. If anybody's listening to this and they're looking at their endoscopy report and they're like, oh yeah, someone mentioned this to me once. It might say Barrett's, it might say intestinal metaplasia. And I remember back in the day in medical school, I was like, what are these terms? Metaplasia, dysplasia. And I always remembered metaplasia means movement in the esophagus. So, movement of the gastric cells into the esophagus.
Mm.
And it's just a replacement. And then the body kind of tags those like, hey, wait. Now, not all of those cells will turn into cancer. So, if you have Barrett's, only about somewhere around 7 to 8% of Barrett's will eventually become cancerous. But the problem is we never really knew who those people were, right? So about 1% of the population, at least, some say up to 5%, has Barrett's. And so, but if only 7 to 8% of those develop cancer, how do we find out which people are going to get cancer from their Barrett's? And that's where these sort of newer age molecular diagnostic tests are coming in, the age of personalized medicine. So there's a company called TissueCypher, which I use all the time. Shout out to TissueCypher. And what they do is basically they take your sample of Barrett's and after it's confirmed that it's Barrett's, they run it in their lab and they can actually give you a risk analysis of your specific Barrett's of turning into cancer. And so I love being able to come back to a patient and say, okay, everything looks good. Your risk of Barrett's, like I told the patient today, your risk of Barrett's is 0.6%. So that's really nice, right? You want to hear that. But also, I'm sometimes like, whoa, like I've seen Barrett's where it's a couple centimeters, looks totally fine. And then they tell me the risk is 16%. And I'm like, okay, that's really high. 0.6% and 16% are totally different. So it helps me, determine what to do with patients long term, how to monitor
And the
them, what to send them
uh,
for.
and this is through an endoscopy, which is like a colonoscopy, but through the mouth? So it's the same procedure. Is it the same procedure as a colonoscopy? Like,
Well,
except the other hole?
other hole, yeah. I know patients
Okay.
ask me sometimes, like, do you do surgery? And I'm like, no, I only use the holes God created for you.
Yeah, yeah,
Um,
yeah.
but yes, it's a colonoscopy through the mouth if you want to think of it like that.
Same prep, you get knocked down on propofol and everything?
No prep, just nothing to eat or drink after midnight.
Oh, no prep. And that way you can take a camera and see, and do you do the Wonder Woman lasso there as well? If you see polyps, you grab them.
If you need to, there's the polyps in the upper GI tract are not as common.
Mm.
Very rarely do we see precancerous polyps in the upper GI tract, sometimes in the duodenum or the duodenum. They're definitely not even close to as common. But what we do is we take pictures, we take lots of biopsies. And so we're looking for all sorts of things when we're in there. So when you're in the small intestine, sometimes we'll be doing an endoscopy. I mean, we're talking about GERD, but we're also talking about endoscopies. So the duodenum is a place where a lot of nutrients are absorbed, a lot of vitamins, like your fat soluble vitamins and iron. And so if you have something like celiac disease, for example, you're going to see flattening of all the villi or the little finger like projections that absorb all the nutrients. You're going to see flattening of those in the duodenum. You can have upper GI Crohn's disease, which causes that. You can have Crohn's in the duodenum. You can have Crohn's disease in the stomach. Also, in the stomach, we can see things like ulcers. We can biopsy for H. pylori, which is an infection that you get. We can look for something called hiatal hernias, and we're biopsying again for Barrett's and things like that.
What's a 2 questions I have for you. I did have an ulcer, I named her Betsy. What is an ulcer and what is a hiatal hernia? Did I say that right?
Yeah, yeah.
Hiatal hernia. Yes.
Hiatal hernia with GERD. Um, GERD. This our poor editor who has to cut this is going to be like, this is so annoying. Um, Poor Caro. Okay, so ulcers are a little different than esophageal. Like, so ulcers are basically when the lining gets eroded and inflamed so much that you kind of get almost like a scooped out hole, but it doesn't go all the way through. But it basically is an area that gets super, super eroded. And because of that, it gets like bloody and pus and it kind of can erode into vessels. And it can be from lots of things. The two most common causes of ulcers, at least in the United States, are NSAIDs. So like ibuprofen, Aleve, Motrin, Advil, all those things, and H. pylori infection, which is an infection that you can get. We think it's from the water, but we're really not 100% sure. But you can get it, and it's very contagious, and it kind of burrows into the lining of your stomach and stays there for, can be decades even. But it increases the risk of ulcers, but also other things like lymphomas of the stomach and things like that. So we have to biopsy for it to see if we see little bugs under the microscope. And if you have that,
Yeah. I just had, I think I was in grad school and I had like, burning tummy, like, feeling, like a little hole in my tummy, and Doctor Hopkins was like, "You have an ulcer." My friend Mona got mad because I named it Betsy, and I had to be put on a Pepsids or something to and what does a Pepsid do?
okay, so a Pepsid is something called an H2 blocker. So now we're getting into meds. So we've got
Mm.
lots of medications for GERD. Let me go back. I'm just going to go back because I want to answer your question as to what a hiatal hernia is,
Yes,
because a lot of
please.
people want to know what that is. So I tell people, we talked about how the esophagus is a tube and it's connected to the stomach, right? And a hiatal hernia is basically where the stomach kind of slides up into the intestine. So I like to call it like I'm sorry, into the esophagus. I like to call it like a shoulder shrug usually. So it kind of like telescopes up into there. And so you can imagine if your stomach is sliding up into your chest, you're going to
Ooh.
have much more risk of acid reflux and acid reflux damage because the dang thing is in there, right? So, um, you're much more likely to have damage or esophagitis or Barrett's or ulcers or whatever when you have a hiatal hernia.
Okay. And how do we treat like all of this? Like I have questions about Tums to Tum and like all the different remedies. So walk us through all the different meds that are available for the hernias, for GERD, for ulcers. Like give us a overview,
Okay.
please.
So I'm going to start by saying when you ask about the hernia, the treatment of a hiatal hernia is managing the consequences of a hiatal hernia. So the consequences of a hiatal hernia are GERD or, heartburn or
Yeah.
whatever. So you want to start by managing that. And so again, I want to reiterate, I know I sound like a broken friggin' record, but diet and lifestyle is the first therapy of choice. Then we have lots of different avenues we can use to treat. So starts with things that I like to call neutralizers. So, sort of lower tier neutralizers are things like Tums, calcium carbonate. Tums is a neutralizer.
Okay.
Mylanta, sort of similar. Malox, what they do,
What do they do? Yeah. Thank you.
they neutralize the acid, right? So, we talked about how hydrochloric acid is being secreted. It neutralizes that. It binds to those acids and decreases the or increases rather the pH of the stomach. So on the spot, it neutralizes it. Imagine there's like acid and you pour like a base in it and it becomes less acidic.
Yeah, you were a chemistry major. I failed chemistry. So the visual I have is like little firefighters extinguishing milk to just cool the flames down or something
Yeah,
like
I mean,
that
yeah,
in
that's
my bag.
fine. However you wanna think about it, it's a neutralizer.
Okay. All right.
And then there are and sort of along those lines is pepsid, which is an H2 blocker. So it's sort of a similar in the neutralizer component, but it's not like you said with the firefighter and hose things. It's sort of more selectively finds those hydrochloric acid molecules, binds to them after they're secreted, and neutralizes them. So it's like magnet to H plus ions. Imagine take
So the
Pepsid, it finds the H plus ions and just you know.
s- did you ever watch Detective Gadget? I'm really making myself
First
vintage.
of all, it's Inspector Gadget.
Oh yeah, Inspector Gadget. Dun 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 dun.
No, it doesn't go
Inspector
dun dun dun
Gadget.
dun. It goes
What was
dun
it? Dun dun
dun
dun
dun
dun.
dun dun.
Dun.
Dun. Inspector
Yeah,
Gadget. Dun dun dun
yeah.
dun dun dun. Dun.
Okay, with Penny, and I don't remember the dog's name. I don't remember the dog's name. So if anyone who comments and reminds us what the dog's name is, please do it on our chat channel. Okay, so this one it actually investigates and inspects and finds the area to um neutralize selectively. Uh okay, what's the third one? What's something else?
So then there's medications called PPIs, which are all the rage. Proton pump inhibitors is what it stands for. And so the way, remember I said that food is a trigger or drink is a trigger for the acid to be secreted. So the acid is secreted from something called a proton pump. And you can imagine it like a wheel that you turn. And every time that wheel turns, an acid ion or an H plus ion is pumped into the stomach. Doot, 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 right? Like one drop at a time. And so, neutralizers wait for that H plus ion to be there. The pepsin will bind it and neutralize it. The Tums and stuff just kind of neutralize the whole puddle of acid. But what proton pump inhibitors do, so those are medications like Prilosec, Nexium, omeprazole, pantoprazole. If you've ever heard of those are proton pump inhibitors. What they do is they stop the wheel. Before the H plus ion even gets secreted, they stop the wheel from even pumping. So that's what proton pump inhibitors are. So you can imagine as we're going down this path that I'm talking about, things are getting stronger and stronger, right? Because we're going farther and farther upstream in how acid is being secreted.
Yeah, I don't have a clever cartoon character for the wheel. I just think of a wheel and that how it pauses it. Like don't roll until we get a grip on what's going
Exactly.
on.
Yeah.
Yeah. Okay, that's a good visual imagery. All right.
And and then there's also there's so that used to kind of be like the strongest of the strong, but in the last couple of years there's been a new guy on the market, which is these guys are called PCABs, PCABs, and they're even stronger than the PPIs because they block the wheel from even functioning. So it's like before you even get to the wheel, they're blocking. So they're not even sending messages to the wheel. It's like they're like the factory that makes the wheels. They're just shutting down from all the way at the top. That's a medication called Voquezna.
Volquezna. That's like New Kids on the Block going, oh, hanging tough. Like, just stop. Like, don't even try coming here. So they just are an army that prevents it from even like getting to the wheel.
That's
Okay.
kind of like the down and
PCAT.
dirty. There's also a group that I did not talk about, which is called I want to call them cytoprotectants, which is a really long word. But basically, you kind of talked a little bit about coating, it's like, oh, it's like coating the whole thing. And there actually are medications that coat the lining of the esophagus and the lining of the stomach. And prescription wise, that medication is called sucralfate or carafate, and it's a coater. and it's a protectant of the lining. It doesn't do anything to the acid or to the pH or to the neutralizing or whatever. It just kind of I like to tell patients, like, it's just giving everything a second, right? It's like just hold on. It's like putting on a Band-Aid. It's like giving the body time to heal itself, but you just put the Band-Aid on for a little bit. Whatever's going on underneath is going on, but just the coating kind of helps. And more in the esophagus, I don't really have prescription as much, but I mean, you can use liquid Carafate, but there are these medicines called alginates, sodium alginates, and there's a really popular one right now. I know you can get it like on Amazon and stuff, called Reflux Gourmet, and it's like a little solution kind of. And
Sounds like a meal that I'm gonna be getting or
I
something
know,
in the
right?
mail,
It
like
is actually
thistle or
sweet. I
something.
think they come in like vanilla and chocolate, actually flavored or something.
And what do
Um
they do for you?
And that's what they are. They're basically coaters of the esophagus. So it's kind of like, you take it, and even if you're having reflux, it's not going to allow that reflux to burn away at the esophageal lining because it's coating it and protecting it temporarily.
Are there any things we can do? Like, okay, so I probably know the answer to this, but alcohol is probably a hard no when you have GERD.
Yeah, alcohol's very bad, but probably in like the rankings, like the worst is probably wine. Wine's no good.
Okay.
Red wine being like the absolute worst offender, which is like offensive to me because I really love red wine. So it just feels
You
like a personal attack.
wait, what type? Are you a cab girl? What are you?
Oh, definitely. Like the drier, the better.
I'm a cab. I think as you get more vintage, your taste in wine gets heavier. So I like cabs.
Yeah,
Um,
definitely.
okay, so definitely no wine.
Yeah, I mean, I
Um,
think it goes probably like red wine is like the worst. And then, just like other wine, bubbles aren't great either for reflux. So a lot of like carbonated stuff, champagne is probably not great. And then,
no
hard
fizzy
liquors.
water. No fizzy water.
So it's not horrible for reflux. It's just that it causes a lot of belching,
Right.
and belching increases the risk of exposure to gastric contents into the esophagus. So it's not like fizzy drinks increase acid secretion. It's that fizzy drinks increase belching, which thereby increase exposure of gastric contents into the esophagus.
Okay. So anything else on the alcohol hierarchy? Did I
I
miss?
mean, I think probably like the safest thing alcohol wise is like plain old, like, clear liquor. Um,
Like
so
vodka?
vodka on the
Whiskey?
rocks, basically. But, you have to be careful because, like, I had somebody who was getting terrible reflux because they were drinking so many margaritas, and I was like, "You gotta cut this citrus. This is killing you." And I did fix their reflux by switching to tequila on the rocks. So I don't know if that's, like, helpful for things, but, you know.
Are there any foods we can eat? Because like turmeric or what yogurt, like, are there things we can eat naturally that calm our esophagus down? Like, calm the fuck down. Like, what can we eat?
Well, I mean, you mentioned like, things like milk, things like yogurt. They are kind of cooling in a sense. Um, Peppermint can help with symptoms. So peppermint is a smooth muscle relaxant, but you have to be really careful with that because if you have peppermint, right? If you um drink or whatever, drink peppermint, it will loosen the junction muscle here between the stomach and the esophagus because this is a muscle. And so that actually increases acid reflux. So I
Oh,
tell
stop
people,
it.
like, it's good for the stomach, but it's also really bad for
Oh,
reflux.
snap. Okay. And I'm just dying to ask this question. Like, belching, like burping. Like, what is going on? We'll end it with this. What is going on when we burp? The anatomy of a burp.
It's just air that's being released. So you generate air in the stomach, and then there's intrathoracic pressure and the diaphragm, which is a muscle. And basically, if there's too much air, it can't go down. Some of it comes back up.
Or the other way?
or the other way.
Because, it's so important with little newborns. We got to make sure they get that air out because they just cry. And I'm like, are they feeling that heart attack type of
No,
feeling that
it's
we.
because, the more air that you have, everything gets distended, right? And that distension causes like pain and bloating, and air trapping is painful. So you've got to get air, you don't want to keep air trapped inside of you. So burping is good, things like that. There's all these techniques actually. Some people are terrible air swallowers. So when they eat, they're like, I'm going to move my mouth from the microphone, but they're like, and those people are taking in so much air when they eat that they actually like can increase reflux and belching and bloating and all these things. So there are actual speech therapists, like feeding therapists, that teach people how to not air swallow so much. And there's actually techniques on that. The first step is that you should not be drinking while you eat. You should you should actually drink your drink after you're done eating your food. Because if you're eating and then drinking, you're increasing air swallowing.
Oh, okay. So eat and then have a beverage after, and chewing. Anything else we can do to air? Did you call it air swallow?
Yeah,
What did
air
you say?
swallowing.
Air
Like this.
swallow. A whole new term. Air swallowing. Okay. Is there anything else we can do to minimize our air swallowing?
Sipping from a straw is helpful because
Okay.
when you are sipping from a cup, you have more of an open mouth, so you're getting more air in with every sip.
So sippy cups, or what's the Owala? Oh, what's the
Yeah,
cup I got?
awalas.
Owala? Yeah, they're
Yeah.
just like dumb proof because I fall a lot and I need a cup that will like go down with me. And it's like an adult sippy cup. I love them. Chew, use a straw, ease up on the peppermint tea, yogurt, milk. Um, uh, there are therapists that can help you minimize your air swallowing. Anything else? This has been a fascinating conversation.
I know. I knew you would like GERD.
Ins and out of GERD. GERD. Yeah. Awesome. Well, any other parting messages, Dr. Soika, before we leave our listeners?
Just I think, the moral of the story is GERD is super common, but if you've had it for a really long time and or you maybe had a little bit and now all of a sudden it's increasing in frequency and it wasn't like this before and now everything you eat is giving you GERD. There's been a change. Or if you're having any of those swallowing problems, if you're feeling like things are sticking, come and see us because, the worst thing also is, things like Barrett's can turn into esophageal cancer. So we don't want to miss that. So if you're having difficulty swallowing, if you're having a change in your symptoms, if you've had GERD for a long time, come and see us so we can talk about risk and mitigate that and make sure you don't get cancer.
Thanks, Dr. Soika,
You're welcome,
and thank
Sonia.
you for listening to the ins and out of GERD.
Thank you. See you next time.
Bye.